Good day, classmates. So, our report is Hepatitis A. Background. Hepatitis A is a liver disease caused by the hepatitis A virus. The virus is primarily spread when an uninfected and an unvaccinated person ingests food or water that is contaminated with the feces of an infected person. The disease is closely associated with unsafe water or food, inadequate sanitation, and poor personal hygiene. Hepatitis A occurs sporadically and in epidemics worldwide, with a tendency for cyclic recurrences. So, according to the report of WHO, uh, it is responsible for an estimated 1.5 million clinical cases of hepatitis and tens of millions of hepatitis A virus infections worldwide. So, the hepatitis A virus is one of the most frequent causes of foodborne infection. Epidemics related to contaminated food or water can erupt explosively, such as the epidemic in Shanghai in 1988 that affect about 300,000 people. Hepatitis A viruses persist in the environment and can withstand food production processes routinely used to inactivate and control bacterial pathogens. So, history of the patient. A 19-year-old woman was rushed to the emergency room. She is complaining of a 10-day history of anorexia, nausea, and upper abdominal discomfort. 2 weeks earlier, she had experienced some mild arthralgia in her fingers, which lasted for 2 days. She had noticed that her urine was much darker than normal. On her physical examination, her skin appears yellowish with indicative of jaundice, have a low-grade fever of 38.1 degrees Celsius. Her blood pressure and neurologic exam are normal, and there is no rash. There were no needle tracks on her arms and fingers. So, laboratory result. So, her initial laboratory study shows. So, according to the result given, she had a normal CVC and diff count. So, negative pregnancies. And her chemistry test shows as follows. So, ALT and AST are above the normal value. So, ALP still in the range for normal value, and total bilirubin is high, because total bilirubin um, maybe an indication of liver problem. Also the ALT and AST. So, blood urea, nitrogen, and creatinine are still in the normal range. So, according to the case, the physician also requested serologic testing. So, total anti-hepatitis A virus positive, IgM and anti-hepatitis A virus positive, total anti-HBC negative, IgM anti-hepatitis B core antigen negative, hepatitis B surface antigen negative, anti-HBs positive, anti-HCV negative. So, according to the serological markers, if IgM and anti-HAV are tested, it is clinically significant to acute hepatitis A. For total anti-hepatitis A virus, it is immunity to hepatitis A. So, hepatitis A virus RNA, detection of hepatitis A virus in clinical, food, or water samples. So, the discussion. Hepatitis A is a viral disease that affects the liver. So, yun nga, nagpa-test po, nag-request yung physician niya ng for liver profile like AST, ALT, and total bilis. Anyone can be infected with hepatitis A if they have direct contact with food, drinks, or objects contaminated by the feces of an infected person. Hepatitis A is also common in developing countries where hygiene standards are poor. So, symptoms may last for several weeks, but full recovery usually occurs. A single infection of hepatitis A will give you lifelong immune protection. So, caused by hepatitis A virus. The type is RNA, and hepatitis A virus is um, belong to the Picornaviridae family. So, the recovery will be 3 weeks to 6 months. So, the incubation period, usually it takes 15 to 50 days with an average of 28 days. The most common signs and symptoms associated with acute hepatitis A include jaundice, fever, malaise, anorexia, and abdominal comfort. So, tests. So, these are the tests used to diagnose hepatitis A may include medical history plus immunization status. So, vaccine. So, there are two vaccine available for hepatitis A, which is the initial shot and the booster shot. So, physical examination, blood test. So, chemistry, usually the liver panel, bilirubin, ALT, AST, alkaline phosphatase. So, serology test for hepatitis A virus. Hepatitis A virus IgM antibodies. This is specific routine diagnosis, indicator of acute hepatitis A. Antibodies generally appear 4 weeks after infection, so 5 days before symptoms. May persist up to 6 months after onset of clinical symptoms. Total hepatitis A virus antibodies, the IgM and IgG, indicate past infection or immunization, presence associated with immunity. So, madedetect lang yung HAV antibodies um, pag may past infection na. So, or presence associated with immunity. Assess immunity for hepatitis A virus from vaccination or previous infection. IgG does not appear until convalescent phase but remains detectable for life. So, treatment. There is no specific treatment for hepatitis A. In most cases, your immune system will clear the infection and your liver will completely heal. So, minomonitor, minomonitor lagi yung sa liver panel sa chemistry for the progression ng treatment kung nakaka-recover yung liver. Treatment aims to ease symptoms and reduce the risk of complication. Vaccination against hepatitis A should be part of a comprehensive plan for the prevention and control of viral hepatitis. So, summary. Hepatitis A, which is caused by hepatitis A virus, which is a small RNA containing picornavirus. it can invade the human body through food or water contaminated with a small amount of feces. It can also be spread through contact with an infected person or rarely through contaminated blood. Most people with hepatitis A fully recover without treatment. Diagnosis of hepatitis A is made by biochemical assessment of liver function, bilirubin, ALT, AST, and alkaline phosphatase. The specific routine diagnosis of acute hepatitis A is made by finding anti-hepatitis A virus IgM in the serum of patient. Virus and antibody can be detectable by commercially available RIA, enzyme immunoassay, or ELISA kits. At the onset of the disease, the presence of IgG anti-HAV is always accompanied by the presence of IgM anti-HAV. As IgG anti-HAV persists lifelong after acute infection, detection of IgG anti-HAV alone indicates past infection. If laboratory tests are not available, epidemiologic evidence can help in establishing a diagnosis. So that's all about our report in hepatitis A. Thank you for listening.